All right, good afternoon, everyone, and welcome to this month's Roberta Ferrence lecture series as a part of our Teach Educational Rounds. Here with us today, we have Dr. Lilian Dindo, who will be presenting on acceptance and commitment therapy, a transdiagnostic intervention for addiction. So we'll start off today with CAMH's land acknowledgement. CAMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty Number 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. So I now invite everyone to share where they're joining in the chat. If you're not sure, I'll put a link right now that you can use to find out. And you're welcome to share, yes, what traditional lands you're joining us from today and use this link to find out. And you can also share something you are currently doing to learn or improve your commitment to reconciliation. So I'll just give everyone a moment to do that. And in the meantime, while everyone keeps going with that, I'll just share my own personal land acknowledgement. My name is Rachel. I am a second-generation Canadian located on the lands of the Mississaugas of the Credit, which is covered by Toronto Purchase Treaty 13. I continue to listen and learn about the stories and cultures of various Indigenous communities and ensure that their voices are heard. And this is just a gentle reminder that if you are interested in receiving a letter of completion for this Roberta Ferrence lecture series as a part of our Teach Educational Rounds, to make sure that you have registered for this webinar and completed the pre-learning assessment. Also, to sign into this webinar using your first and last name so we can identify you, and to complete the evaluation and the post-learning assessment, both of which will be sent out after this webinar. And just a reminder, this webinar is in honor of Roberta Ferrence. And Roberta Ferrence is an adjunct professor in the Dalla School of Public Health at the University of Toronto and a senior scientist with the Center of Addiction and Mental Health. She has been involved in tobacco and alcohol research for many years, and her research interests include the epidemiology of tobacco use and alternative nicotine products, the impact of tobacco policy on health, the role of tobacco use and exposure in mortality and morbidity, and economic factors in smoking behavior. And in recent years, she has been involved in research on environmental tobacco smoke exposure in public and private environments, behavioral and economic effects of restrictions on smoking, water pipe smoke exposure, and electronic cigarettes. Dr. Ferrence has served on numerous committees and task force for the National Cancer Institute of Canada, the Canadian and American Cancer Societies, the U.S. Institute of Medicine, the U.S. National Institutes of Health, Health Canada, and the Ontario Ministry of Health and Long-Term Care. She was lead editor in the Nicotine and Public Health, published by the American Public Health Association. So welcome. And I will now pass it along to Dr. Selby to introduce Dr. Dindo.
Thank you, Rachel. Hi, everybody, and please join me in welcoming Dr. Lilian Dindo, who's a PhD and a clinical psychologist and tenured professor, associate professor in the Department of Medicine, Section of Health Services Research at Baylor College of Medicine, and a research health scientist at the Houston Michael DeBakey VA Medical Center, and an expert fellow at the Rice University's Baker Institute for Public Policy. I've had the pleasure of hearing Dr. Dindo before, meeting with her and learning about her really interesting work, both clinical and research, which has been focusing on developing innovative and pragmatic psychotherapy interventions that are aimed to improve the mental health and functioning of patients with mental health and chronic health problems, and a strong focus on acceptance and commitment therapy as a treatment approach. And secondly, she identifies psychological mechanisms of action of these effective treatments. She runs workshops for veterans and civilians with multiple comorbidities to help them learn new ways to cope with their difficulties and improve their quality of life. She also has been funded by the NIH, VHA, the Office of Rural Health, and is a site leader for the Houston Mental Illness Research, Education, and Clinical Center. So without much further ado, I know we only have a short time with her, and I want to make sure we optimize the time. So again, on behalf of all of us, thank you for being here, and I'll hand it over to you.
Thank you. Just before you get started, Dr. Dindo, a couple of disclosures. Just to note that all Teach Educational Rounds presenters are offered an honorarium. However, acceptance of this honorarium does not impact Teach Educational Rounds content. And this is also to note that the content of Teach Educational Rounds are centered on evidence-based guidelines from the following sources, which I'll give everyone a moment to read. Nonetheless, these materials, as well as their verbal discussion, and represent only general principles and do not remove the need for clinical assessments or treatment plans by healthcare professionals. And now I'll pass it to you, Dr. Dindo.
Hi, good afternoon, everyone. Thank you for having me. I'm going to be talking mainly about acceptance and commitment therapy today, and I will try to include how each process and act is related to smoking cessation in particular. So it's going to be pretty heavily clinically focused. I will, though, start with kind of just talking very broadly about the evidence base before I get into the actual practical application of ACT. So acceptance and commitment therapy is a transdiagnostic behavioral intervention. It's applied to human difficulties generally. So it is not, for example, ACT for depression or ACT for anxiety. It is seen as an intervention that applies generally to human functioning. So the processes that I will talk about today apply to any human being who's encountering any challenge, including, for example, smoking. ACT is an empirically based intervention. At this time, there are over 1,400 randomized clinical trials of ACT. In general, it is, meta-analyses have found that in general, it is equivalent to other gold standard interventions like traditional CBT. And in some cases, it does better, like in specific areas. But we'll talk about that. The American Psychological Association has listed ACT as an efficacious intervention for a range of psychological and medical difficulties like depression, anxiety, psychosis, chronic pain. So I just wanted to kind of talk briefly about the research evidence in smoking cessation in particular. The Affordable Care Act in the US lists ACT as an evidence-based cessation program. One of the largest research programs on smoking cessation using ACT is by Dr. Bricker, who's at the Hutchinson Cancer Institute in Washington. And he's been doing this research now for about over 10 years with over $15 million in funding. For example, he's developed a telephone, web, and app-based intervention of ACT for smoking cessation. And in the past decade, they have found that his program, this ACT-based smoking cessation program called Smart Quit, is about 2 to 3 times more effective than just the other government-based programs that focus on avoiding cravings. Their research has also found that the work that when they engage in the ACT intervention, it also helps with other issues such as anxiety, depression, and people learned how to manage stress more generally. They didn't gain weight. And then there have been other research studies showing that ACT versus nicotine replacement is equivalent at the end of the trial, but at 1 year follow-up, for example, the ACT intervention does better than NRT. Similarly, other studies showing that ACT does a little bit better than bupropion in cessation. So just kind of a brief overview that there's strong evidence for ACT for smoking cessation. So I'm going to start by just kind of telling you briefly about the ACT principles. And I do this before I go into each of the processes of ACT. So in ACT, it's really about that a rich and meaningful life is about what you want in life and not what you don't want. For a lot of people who work with patients, you'll have patients coming in and saying, I don't want to feel sad. I don't want to feel anxious. I don't want to feel insecure. And we turn that around and really ask, what is it that you do want in your life? So it's about going for something that you value rather than escaping or avoiding things that you don't like or don't want. And a basic premise in ACT is that everyone will experience pain, suffering, challenges, and it's about how we respond to what life sends our way and how we live out our values in every moment. So really just the idea that we will all encounter difficulties, and it's really about how we're going to respond to what comes our way. Another really important piece in ACT, and we'll get into this with much more depth, is that we get to choose our actions, where we go, what we do with our hands and feet, and what comes out of our mouth. We have relatively little choice about the memories, feelings, or the thoughts that show up in a particular situation. And we will talk about this in more depth, but the idea is that if I have the experience of sadness, I have little choice if that feeling shows up. What I do have a choice about is what I do with that sadness. Do I still move forward? Do I still get out of bed? And so the idea is that the most effective way to change our lives is to focus on changing our actions and learning new ways to deal with our troubling thoughts, our troubling feelings, and our memories. So overall, our emotions are important and they need to be respected and accepted, but they do not control our behavior. We can feel angry and act kindly. We can feel fear and go ahead. We can feel unmotivated and still take action that's consistent with our goals and our values. So this is the model of ACT. That wasn't supposed to come up that way. Did it? Are you in the slideshow? Okay, I don't know, but it's a little overwhelming this way. But anyways, Rachel, are the animations working?
No, we're not seeing I'm not seeing animations. Like transitions?
Yeah.
No.
Okay. Well, we might need to switch, but anyways, there are 6 processes in ACT that are all interrelated. And these 6 processes essentially lead to greater resilience. And there's the flip side of the resilience. So, for example, acceptance versus avoidance, defusion from thoughts versus fusion with thoughts, being in the here and now versus ruminating in the past or worrying about the future all the time, engaging in committed actions versus inaction and impulsivity, being really connected to our values and what we care about versus not being very clear on what we want our life to look like. And then keeping perspective versus an inability to view things from a different perspective. So in ACT, these are the 6 processes that we try to cultivate in the people we work with. So I'm going to go through each of these processes and give you an example, give you examples of what it looks like clinically. So the first one, which is really the heart, I would say, of ACT, is connecting to what we care about, you know, and we can move forward. So the question or the issue of values is really kind of encouraging people to think about deep down what is most important to you. What do you want your life to be about? What kinds of relationships do you want to build with others and with yourself? And the idea is that our life is made up of many, many choices. You wake up in the morning, do you get out of bed? How do you interact with your children? How do you interact with your colleagues? How do you interact with your partner, right? So how do you want to show up in your life? What do you want to stand for is really what values are about. Sometimes people have a little bit of difficulty. No, you can move on. Sometimes people have a little bit of difficulty identifying what their values are because sometimes society is telling us what we should value, for example. So sometimes we'll ask people, what do you value in others? What describes someone you like or admire, or even describe someone you don't like or don't approve of? And what do these descriptions actually tell you about what you would like your life to be about? So I'm going to ask you all to just do a simple exercise with me, if you don't mind. And again, Rachel, I wonder if I should be sharing my slides because I wanted this to come up more slowly, but would that be difficult? I can't hear you.
Did you want to try sharing on your end?
I think it would be better
Yeah, we can definitely try that.
because it's not doing it the way I would like it. But let me see.
Let me know if you have any trouble sharing them.
Okay, it's not letting me. Let's just keep going then. So if you don't mind, just take a moment to think about, let's imagine that it's 10, 15 years from now, and you continue living your life exactly as you do now. You don't make any changes really. How would you fill in the blanks? I spent too much time. And if you want to put some answers in the chat, that would be valuable too. I spent too little time doing things such as. And based on this, what I would do differently now is. So many people say that it's quite easy to answer these questions, right? And, you know, some of the things that were put in the chat are some of the most common responses we get. I spent too much time worrying. I spent too much time, you know, working and not playing, there are many common, exactly, Suella. And spent too little time doing things such as having fun or spending time with family. So it's important to just pause and ask yourself, you know, this question now rather than wait until it's too late. Okay. Okay. So here's another question I have for the group, even though I can't see you. If I asked someone in the group, like there's a building outside and it's on fire, would you actually go into that building? If I said, go into that building, would you do it? Just quick answer. Okay. So a lot of you had quick answers to that. And now I'm going to ask you a different question. And some of you already put this in the chat, which is, what if I said your child is in there? Or if someone you love is in there? Does your answer shift? Okay. So the answer shifts suddenly and very quickly, right? From those of you who said no right away, it suddenly changed to a yes. Okay, next slide. And this is important because if someone has a why to live for, they can bear with almost any how, right? And so the question is, why would I do something really hard? Why would I do something that might be scary? Why would I do something that might be uncomfortable? So the values are what provide the motivation to do something that might be hard or uncomfortable. Okay. So when it comes to smoking, for example, right? Initially, people may have started smoking because it might have been fun or exciting or part of a social setting, right? The reason why someone starts smoking often is quite different from the reason why they persist, right? Over time, smoking becomes routine, habitual, something associated with guilt, anxiety. And often smoking is inconsistent with things that actually matter most to a person. And so it's worthwhile asking the people we're working with, our patients, to think of a future image of themselves in 10 years from now, for example. What would their ideal relationship with smoking look like? Sorry, but I'm struggling here because I really wanted my slides to be.
Do you want to try sharing again from your end?
I am going to try again if you don't mind.
Yeah, that's okay. I'll just close this. And then you can try. It should let you.
Can you see it?
I can see that.
Okay.
Yeah, it looks like in the chat, people can see it too.
Yep, it's good.
Okay. You can see this.
Yeah,
Yes.
but we're seeing your overall, like, not your presentation view.
You're not seeing my presentation view?
No, we're just
I
seeing,
think
maybe you have to, if you got two screens, you may just have to, on the top it says flip, and you'll be able to flip it to, or when you go to share, if you already have it in presentation mode, you could, when you
or to
share
share
screen,
as a
share
slideshow.
presentation.
Now?
I think if you press from current slide, then it should show it as the slideshow.
I don't know why it's not letting me.
Why don't you do that?
Rachel, do you know why it's not allowing you to show it? And
No, my only thing is if it was working on yours, then I'm actually not sure, but it could have to do with WebEx maybe not being able to show the transitions.
Yeah, it just could be that sometimes the transitions don't show on.
It can be finicky in that way.
okay, I don't think I can do anything about it then. Sorry, but do you mind just resharing
No,
then?
no worries. Yeah, let me just pull it back up again.
Sorry, everyone.
But sorry about that. Yeah, maybe WebEx just doesn't allow it. Okay, just give me a moment and I'll go back.
Okay, so while you're doing that, I'll just say, so we did the values piece. The next one that I want to talk about is committed action. So once you clarify what your values are and what you want your life to look like and how you want to be in the world, then the next issue is something we call committed action, right? Versus inaction and impulsivity. And you can move forward. So we make our values important through our actions, right? And the choices we make. So if I say, for example, that my son is really important to me, saying it is not enough. I have to put that into action. I have to show up for him, right? If he cries in the middle of the night and I say, I'm too tired to get up, it's exhausting, I can't be bothered, right? Then that's actually not living out my values. And so a fulfilling life is one where you actually do the things that are most meaningful to you. And we talk a lot about that. We can move forward. We talk a lot about that in terms of, so an example I always use is I worked with a patient who, talked a lot about how important his son was to him. But he worked, 12, 13-hour days. And at the end of the day, he would go to the bar and he would actually take out pictures of his son and show the pictures of his son to the people at the bar. And he would go home quite intoxicated, wouldn't really spend time with his son, wake up the next day a bit hungover. And so it's really important to pause and ask ourselves if our behaviors are actually reflecting what matter most to us in our lives. And so when we talk about our values in action, we talk about what are the promises we're making to ourselves, to our families, to our fellow co-workers. So one way to think about this is sometimes I'll say, okay, where are you at on a scale of 1 to 10, right? On being the kind of partner you want to be, right? And so 1 is terrible, 10 is you're being the perfect partner, right? So let's say I say I'm a 5 at the kind of partner I'd like to be. One way to make it very concrete is then to say, okay, well, what's one small step you can take in the next week that would actually move you one step closer to being the kind of partner you want to be, right? So sometimes it's like breaking it down into smaller actions that would slowly get you closer to the kind of life you want to be living. So this is just a quote that I really like. Commitment doesn't have conditions. A compassionate warrior follows through whether it feels good or not. Average people do what they feel like doing. And this is an important point in ACT in that if you're going to follow the emotion of the moment, right, then your behavior becomes a little bit unpredictable in the sense of like, if I'm sad, then I withdraw. If I'm afraid, I withdraw. If instead we commit to acting based on our values rather than the emotion of the moment, then our behavior becomes much more stable and predictable. So that's the committed action piece. The next one I will talk to you. So that all sounds lovely, right? It all sounds lovely that we identify our values, we live by our values, and everything sounds wonderful. Well, it's not that simple, obviously, or we'd all be doing it, right? So could there be more to it? And can you move forward, please? Could there possibly be more to it? So it's obviously not that simple, right? Well, what are the barriers? Well, thoughts and feelings often get in the way of doing things that matter. And these are just some simple examples. Things that get in the way of doing things that really matter to us. I'll be uncomfortable. It'll make me anxious. I'm afraid of the outcome. I won't get anywhere. I'm tired. I'll do it tomorrow. I don't deserve it, right? So we have lots of emotions and thoughts that pop up in the moment that then lead us to kind of move away from doing the things that matter to us. This includes exercising, you know, how often do we say, oh, I'll do it tomorrow, right? I'm too tired today. Putting yourself out there, taking risks. You'll say, oh, that's too uncomfortable. It'll make me anxious, right? So what do we do? What do we do about difficult thoughts and emotions that get in the way, right? From an ACT perspective, it's learning how to sit with difficult emotions and thoughts, and we'll go through that versus avoiding them. So I'll show you what that looks like a little bit. Before I show you what that looks like a little bit, I just want you to kind of, I want to encourage you to kind of recognize that emotions, they just show up, right? If I'm about to give a speech, and here I am giving you a speech or giving a talk, right? What do you think is a natural emotion to feel? Okay, so there's 100 people on this webinar. Before it starts, what emotions might I experience, you think? Anxiety. Exactly. Do you think nervousness? Exactly. Fear? Exactly. Do you think that that's a quote unquote normal way to feel? Right. So it is quite a normal way to feel. Now, let's say before I started this talk, I turned to all of you and I said, oh my God, I'm so nervous. I'm so afraid. I'm really anxious. What might you say to me? Like, what's your instinct of what you're going to say to me? Or what does society tend to tell us? Oh, don't feel anxious. You'll be okay. Reassurance. You'll be okay. Suck, suck it up. Right. Exactly. You got this, right? So, exactly. Don't worry. Don't worry. Exactly. So, you guys got it, right? The message we get in society tends to be, don't feel this way. You don't need to feel this way, right? And what I'm trying to say here is that what we feel is okay. It's rather like I can have the anxiety and say it's okay that I'm anxious. I'm about to give a talk. This matters to me, right? If you find out a friend of yours just died, you will feel sad, right? If you get a promotion at work, you will feel joy probably, right? The point is that emotions show up, and society often tells us if it's a challenging emotion, not to feel that way. If I come and say, oh, I'm really feeling guilty about something, don't feel guilty. I'm feeling really anxious about something, don't feel anxious. But it doesn't actually work, right? Instead, noticing it, acknowledging it, allowing it to be there, and still moving forward tends to work better in the long term. However, so see, this would have been beautiful in my animations. I spent a lot of time on this animation, but anyways, So avoidance is the flip side of acceptance, right? Let's say I feel anxious. This is just an example. I feel anxious, so I have a drink. Well, that works well, right? I get less anxious in the short term. The problem is that it doesn't work in the long term. The next day, my anxiety is back, right? I might drink some more, and the vicious cycle continues. Now, I'm using the example of feeling anxious and using drinking, but avoidance is a core issue that we use in most of our emotions, actually. So can you go next? So if we think about avoidance and control with smoking cessation, a lot of the traditional approaches to smoking cessation mostly involve avoidance or suppression of urges, right? The idea is to try to turn off the craving or avoid the cravings and the triggers and or thinking about smoking. And the science shows us that this works well in the short term. However, it might not work as well in the long term, okay? Because it's really impossible to avoid triggers for your entire life. It's impossible to avoid situations, events, or feelings that are going to remind you of the smoking. So, from an ACT perspective, a more effective long term approach to smoking cessation is to learn how to allow cravings to be there, right? Allow cravings to be there, to come and to go, to ride the craving out like it's a wave. So, from an ACT perspective, avoidance, if it's really I think it's very helpful to think of avoidance as a core process actually that can lead to challenges because it applies to any internal thing that we don't want to feel. You don't want to feel pain. You don't want to feel anxiety. You don't want to feel guilt, sadness, vulnerability. So we avoid it, right? Let's say I get into an argument with my partner and I really like it feels terrible. So I avoid having a conversation with my partner. I decide to go to sleep instead, right? Well, in the short term, that works. Going to sleep, I've dodged a bullet. I don't have to face this difficult conversation, right? But it doesn't solve the problem. And the problem comes back stronger if I continue to avoid over time. So the more you avoid, you actually become more and more hypersensitive to things that bother us. And your life is getting smaller and smaller. So we're making the fear of anxiety or pain stronger than what matters most, right? So if I avoid having a difficult conversation with my partner day after day after day, that I'm making that avoidance more important than my partner, right? And over time, this leads to a lack of vitality in life. So again, from a smoking perspective, the acceptance piece is learning how to have cravings, to ride out a craving without fighting the urges. We can skip this because I feel like I'm out of time, actually. Okay. So the next one I want to talk about is, go ahead, diffusion from thoughts versus fusion with thoughts. And this is a little bit of a different approach, for example, than the way traditional CBT would approach thoughts. So, okay, Mary had a little fill in the blank. Lamb. Red, white, and blue. Got it. 1, 2, buckle my shoe. Row, row, row your. Perfect. So, just like emotions show up, thoughts also show up. There are certain thoughts that we have learned throughout our life that just show up. And I gave you silly examples here, like Mary had a little lamb, red, white, and blue, 1, 2, buckle my shoe. The more difficult thoughts are things like, I'm not good enough, I'm not smart enough, I'm not lovable enough, right? We have these automatic thoughts that pop up. And let's say I said to you, okay, well, Mary didn't actually have a little lamb. She had a little cat, right? So I'm challenging this idea that Mary had a little lamb, and I'm telling you, actually, she had a cat. Well, 1 year from now, if I say Mary had a little, what are you going to say? You won't forget lamb, right? You will all still remember lamb. You might also remember cat. You see, our brain does not work by subtraction. We cannot subtract something we have learned, but our brain does work by addition. And so the idea is we can learn new things, but we can't undo something we have already learned, right? And why is this important, right? You can move forward. This is important from an ACT perspective because just because you think something, it doesn't mean that it's true, right? And a thought doesn't have to define us, right? That's the number one reason why it's important to step back and recognize what our thoughts are. Just because I think I'm not good enough doesn't mean it's true. The other thing that's important about this is that thoughts and emotions don't have to control our behavior. And this goes back to almost the very first slide I gave you, which is I can think I'm not smart enough. I can think I'm not good enough, and I can still choose to try to go to graduate school, for example, because it matters, because it's important for me. It's the kind of thing I want to do, right? So from an ACT perspective, we don't challenge thoughts, like we don't try to change the thought per se. We try to help people get some distance from the thought to recognize that if it's a thought, it doesn't have to mean it's true, and it doesn't have to control your behavior. So here's a silly example, but I can say, I'm not good enough. I'm not smart enough, right? Next one. Try that, actually. Can someone try saying to yourself, I'm not good enough? Say it out loud. I'm not good enough. And now I want you to just say, I'm having the thought that I'm not good enough. Okay, move on. So it's not that you're changing it and saying, oh, yes, I am good enough. I'm actually really smart and I'm really good and I'm really beautiful. You're not doing that. You're just saying, okay, step back. That's one of my thought hooks. That's one of the ones that tends to get me. It's a thought, right? It doesn't mean that it's true. So from an ACT perspective, if I'm going to apply this to smoking, right? When you have the thought, I need to have a cigarette now, or I have no willpower, or I'm so stressed, I need to have a cigarette, right? You can step back and say, okay, I'm having the thought right now. I'm having the thought that I have no willpower. It's a thought. It just gives you a little bit of space to pause and say, okay, this is the thought I'm having. How do I choose to act? One silly example sometimes I'll use with the people I work with is I'll say, okay, I want you to get up and walk around the room and say, I can't walk, right? And it's just a silly way to show that your mind can say, and you can say, I can't walk, but you can actually be walking, right? So just because our mind tells us I can't do something doesn't mean I actually can't do something. Again, if we go back to the beginning, if I have a why to live for, if I have a real sincere purpose for why I might want to continue walking, even though my brain is telling me not to, then I would be able to. Okay. Moving on now to present moment. Is that correct? Yep. Here now. So this is the fifth process, which is about how to learn how to be more present versus living in the past, ruminating about the past versus worrying about the future. So research has shown that we spend 47% of our time thinking either about the past or about the future. You can keep going. How many people have been driving? I mean, how many of us will be driving and we miss an exit, or we get somewhere and we don't even really realize how we got there, right? We live a lot of time kind of just on autopilot, just on autopilot, not even really stopping and processing what's happening around us, right? So, from an ACT perspective, the mindfulness piece is really learning how to pay attention in a particular way, on purpose, in the present moment, and non judgmentally. So it's really about living life while paying attention. So let's say, for example, I'm here and I'm giving this talk, right? I could be actually in my head thinking, oh my God, I wonder what they're thinking of me. I wonder if they're finding this boring, right? I wonder, oh gosh, what am I going to eat for lunch, right? I mean, that happens. And really, that takes away from the vitality of the moment, number one. And the person across from me usually can tell when someone's not really present with you, right? And so learning how to be more present on a moment to moment basis promotes vitality and spontaneity. How does this apply to smoking? Well, it's important to kind of reflect on the high frequency and mindless nature of smoking. So, for example, if someone is smoking 20 cigarettes a day, that's 160 puffs a day. So that becomes as routine as walking, eating, and breathing, right? Any behavior that is repeated this often is actually quite mindless, right? And we know that people will often take out a cigarette and light it up without even an urge actually coming up first. So, this present moment focus from an ACT perspective is really helping people to increase their awareness of the mindlessness of the smoking, right? And really starting to learn how to like say, okay, well, I'm going to sit here. Do I really have an urge to smoke right now, for example? Or is it just a mindless habitual activity again? We do, this is just one example where we teach something like dropping anchor, right? And this applies to cravings, to anxiety, to pain. So sometimes when a wave of a painful emotion or an urge crashes,
We seem to have lost Dr. Dindo audio.
until the storm.
Oh, she's back.
Hi, you cut out for a little bit, if you don't mind repeating a bit from the slide.
Okay, can you hear me now?
Yes, we can hear you now.
Okay,
Thanks.
so I'll start again. So here, this is just an exercise that we use to help people kind of get grounded in the moment, with regardless of what the painful emotion might be, whatever, like it could even be a craving, right? When a painful feeling, an urge crashes through our bodies, we talk about dropping anchor, right? It's like a storm just hit us. And so we're going to drop anchor. And when we drop anchor, it doesn't mean that we're getting rid of the storm. We're not getting rid of a craving. We're not getting rid of an urge. We're just trying to hold steady until the storm passes, right? And we teach people how, for example, they can use the breath to kind of get grounded in the moment. Take a deep breath, take 5 deep breaths. You can always anchor yourself to your breath by just noticing it. And we talk about counting 5 seconds on the inhale, 5 seconds on the exhale. But even just a visual of like you're in a storm and you're dropping anchor for a moment. You can move forward. And the last process that I just want to I want to go through is what we call keeping perspective versus an inability to view things from different perspectives. So how does this look in ACT? Perspective taking is really like this ability to step back and notice the stories of ourselves and our history, right? This is in contrast to being attached to a particular self-concept of ourselves, like, or over-identifying with a particular concept of ourself. So what does this look like? So you can move forward. What does over-identification with smoking look like? When you say, I'm a smoker, I don't have willpower, I have an addictive personality, I'm a depressive, right? These are self-narratives and conceptualizations that often can actually interfere, with taking effective action, and can actually maintain some smoking behaviors, right? It's almost like a self-fulfilling prophecy. We start to behave in ways that are consistent with how we're seeing ourselves, right? And so when we are doing perspective taking skills from an ACT perspective, we help people recognize that smoking is just one of many, many behaviors. It's one of many, many things that you engage in. So, saying I'm a smoker, defining yourself this way can actually be limiting, right? You could say something like, I'm a mother, I'm a sister, I'm a aunt, I'm a psychologist, I'm a colleague. Defining yourself as a smoker and being so overly identified with that can be problematic. Another way that we talk about perspective taking is also learning how to step back and look at things from a different perspective. So thinking about something you're actually struggling with, you can ask yourself, well, how might somebody else see the same situation? How would a wiser version of me see this situation? How would a younger version of me or an older version of me see this situation? So again, sometimes when we get over-identified or very attached to something, it's important to step back and see that there are other ways to look at the same situation. We can skip this one because I know we need Q&A. So these are the 6 processes, and I tried to give you like really concrete examples from each of them. And just summary of how it applies to smoking. Can you move forward, please? So just summary, connect with the why of the quitting, right? What would make it, what would make it actually worth quitting, right? Like, is it for your kids? Is it so that you can be healthy? Is it so you can go out and do more activities? Develop awareness of the triggers for the nicotine cravings. Like, what is it? Boredom, happiness, loneliness, stress? What are you trying to avoid? And then keep trying. Like, we know actually that people who keep trying are the ones that actually end up quitting, right? So it often takes 8 to 9 times to attempt to quit. And so this is the committed action piece, kind of like committing over and over and over again to doing this. Allowing the cravings to come and go while not acting on them by smoking. And sometimes we call this like urge surfing, riding the wave of craving. And then noticing the thoughts. I really need a cigarette without acting on the thought, right? I can have a thought, I really need a cigarette and not act on it. Just like I can have the thought, I can't walk, but I can walk. So really the idea is that you don't have to act on a craving. If I wait a few minutes, the cravings will pass on their own, right? We can drop anchor. And we know that cravings pass within a few minutes. So kind of helping people learn to ride that wave can be really valuable. And we can skip that. You can send them the slides, but okay, I can answer any questions now. Thank you.
Thank you, Dr. Dindo. Yeah, now's the time. If anyone has any questions, please feel free to share them in the chat. But thanks so much.
And there was so many comments and responses in the chat. I'm not sure you could keep up with all of them, but really amazing. And while we're waiting for questions to be asked in the chat, I have a question for you actually. Uh, how many sessions would you want this to go over? I know you're very, you do single session ACT, and can you talk a little bit about the number of sessions?
So that's a really good question. And like you said, my big thing in my research is doing 1-day ACT workshops, right? We do the whole intervention in 5 hours. I think the thing about ACT is that it's really, really flexible. Like I mentioned earlier on, like Jonathan Bricker has like an app based, a web based, a phone based, so there's a lot of flexibility in terms of how many sessions are needed. So I've found a lot of, I've done now over 8, 9 trials with one session, but 5 hours, right? And it works. So I don't know that there's a concrete answer to that question. What I will say is that there's a lot of flexibility in terms of how many sessions can be done, but I don't have an answer specifically for in smoking how many hours would be needed.
That's great. Thank you for that. And yeah, we do follow your work, so that helps. I just want to make sure that the audience knew that. I think there are a few questions here. They want books or a workbook to read, and so if there's some references or we could send them, that would be great. And again, another question from Saint Kukoyi is, what if someone cannot identify any values or anything worth changing for? How do you navigate that?
It's a good question, actually, because you do see that. And that's why, like, there are other ways to get, a lot of people have a hard time initially identifying their values because for many different reasons, like, they're too fixated on what society is telling them, or they're too fixated on what their parents told them growing up, right? But sometimes there are other strategies for kind of getting at values. Like I mentioned earlier, like who is someone you admire and why? Or you could just simply try to take it like one step at a time. Like I remember when I was in grad school and when the issue of values came up, I was almost overwhelmed by it. Like, I don't know what my values are. But if you start to ask the question kind of more simply, like in the morning, for example, I wake up in the morning, I see my child. How do I want to interact with my child? How do I want to be as a mother to my child? Okay, I see my friend and, same thing, like a simple question. How do I want to be as a friend to this person? At work, I want to show up to work. I want to be at work. I want to how do I want to be as a colleague? Do I want to be competitive or do I want to be collaborative? So sometimes asking those more concrete questions so I might even say, like, tell me what your day looks like. Like, 8 a.m., 9 a.m., 10 a.m. Like, okay, tell me a little bit about, at 8 a.m., what do you want to be doing at 8 a.m.? How do you want to be with your partner at 8 a.m.? So sometimes getting really concrete can be useful, I think.
Yeah. Well, I think the questions have just blown up, and I don't know, we only have a minute, but I think we're left with the last question, and I think we'll give it to Matthew, who says, can you speak of combining harm reduction approach to quitting smoking and ACT at the same time? Sometimes the absence model of smoking can be hard and can take time.
I'm sorry, you cut up, Dr.
Sorry, it's can you combining harm reduction approach when it comes to quitting smoking and ACT? So if their goal isn't abstinence completely, does ACT work within a harm reduction paradigm where people are wanting to reduce their harms but not completely stop?
So the goal in ACT is, well, not the goal, but something we talk a lot about in ACT is something called workability, right? Workability means, is this working for you in terms of moving something forward? So if with a patient, the harm reduction, like just cutting back, is going to work, it's going to move them closer, then go for it, right? It's not about what's right or what's wrong. It's about what's workable. There's no absolute truth to any intervention you use. It's more about, okay, what would work with this person? What would actually move them closer to getting where they want to go? And if that works for them, go for it.
Great. Thank you. So I know we got to end. We are a minute over, but one last thing is, too many questions. Everybody wants the 5-hour act. I think that may be most workable within primary care. So if there are manuals or books or anything that you can point us to around how that works, that'd be great. And we'd love to have this, continue this conversation if at a later date, if that's possible. So on behalf of all of us, and actually Dr. Ferrence, who's actually in the audience, want to thank you for really enlightening us and sharing your excellent work in this space and helping us think better of how we can help our patients and our clients. So thank you and have a great day.
Thank you so much for having me, everyone.
Thank you.
Bye. Thank you.
So yeah, I understand if everyone needs to go now at this point. We're past the hour. I'm just gonna end off with some housekeeping items, but feel free to leave if you need to at this point. So just a reminder that the evaluation and post-learning assessment will be sent by email by tomorrow, and everyone will have a week to complete that for a letter of completion. So that will be next Wednesday, January 29th. And we have our next Teach Educational rounds coming up next month on the Expand Project 2.0, which will be a follow-up on a previous rounds that we've had before. And registration will be coming soon, so stay tuned for that. And if you've missed a portion of today's webinar or want to view it again or any other webinar, a list of all of these can be found on the Teach website. For now, thank you everyone for attending, and I hope you enjoy the rest of your day. Thanks.